It is health that is the real wealth, and not pieces of gold or silver. It is never too early or too late to work towards being the healthiest you. On this note, I welcome you to yet another educative episode of Healthy Living on Hope TV. My name is Bibi, and in this month of November, we'll be discussing issues concerning sexually transmitted infections. For today, we'll be dwelling on gonorrhea, and I have with me here a doctor to assist us understand this topic better. He's in the person of Dr. Bafor Sapon. He's a general practitioner at Akai House Clinic. Dr. Sapon, you are welcome to the show.
Thank you very much.
I hope you are doing well.
I'm doing very well, by God's grace.
And your day has been fantastic.
Very great.
Right.
Yes.
And how is the family doing?
We are doing very well. It's been okay, by God's grace.
Great. Before we continue, let's go for a quick break. When we come back, we start with our discussion. Don't go anywhere. Hello, welcome back from the break. If you just joined us, you've not missed much because we are yet to start the discussion. Don't forget that you can send in your questions to our WhatsApp line on 0559 680066. I repeat, 0559 680066. You can also join us via our social media platforms on Facebook and Instagram via Hope TV GH, all in lower cases, Hope TV GH. So, Dr. Sapon,
yes.
To start with, what are sexually transmitted infections in general?
Yes, so in our environment, there are several organisms that we don't see with our naked eyes.
Okay.
They can only be visualized using the microscope.
Okay.
And these organisms are called microorganisms.
Right.
Or commonly called germs.
Okay.
They are common in our environment.
Right.
And when these germs or microorganisms enter the human body, they are capable of causing diseases.
Okay.
There are several means or routes that these microorganisms or germs can get access to the human body.
Right.
And one of them commonly is through sexual activity or through sex.
Okay.
So sexually transmitted infections basically means infections or diseases that are acquired through sexual intercourse.
Okay.
And broadly, these microorganisms or germs that we don't see with our eyes, there are several types.
Okay.
We have bacteria, viruses, and parasites. And these can be transmitted through sex.
Okay.
So when you take bacterial organisms, the common organisms that causes sexually transmitted infections that are bacteria is gonorrhea, which we'll be talking more about today.
Right.
And also we have chlamydia as well, and then syphilis.
Okay.
Yes. For viruses, commonly the human immunodeficiency virus, HIV virus, is also transmitted through sex. And then hepatitis B and C are also transmitted through sex. Okay. Another virus that can cause sexually transmitted infection is called human papilloma virus, which causes genital warts.
Right.
Yeah. I also said that parasites can also cause sexually transmitted infections, but not so common. But one sexually transmitted infection caused by parasite is Trichomonas. Yes. So sexually transmitted infection is quite prevalent. at the clinic, we see a lot of young people coming in with several complaints. And upon our investigation, we mostly diagnose them with sexually transmitted infection. So the disease burden is quite high. And so there is a need to create awareness by educating the youth about how they can prevent the transmission of sexually transmitted infections.
Right.
And also when they notice any symptoms, how they can report the symptoms so that they will receive prompt management.
Right.
And then so that they will also suffer from any complications of the diseases.
Okay.
Yes.
But Dr. Sapon, sometimes we hear people mention sexually transmitted infections. At other times, people say sexually transmitted diseases. Is there a difference, or is the same thing that people use interchangeably?
So essentially they are the same.
Okay.
They are used interchangeably, but when one talks about sexually transmitted infections, then you are dwelling more on the type of organism that is causing the infection.
Right.
But when you talk about the disease, sexually transmitted disease, then you are dwelling or stressing more on the disease entity itself.
Okay.
Yes. But essentially they are used interchangeably.
Right.
Yes.
Right.
So there aren't much difference between sexually transmitted infections and sexually transmitted diseases.
Right. Thank you very much. So to our topic for today, gonorrhea. If we say gonorrhea, what at all is gonorrhea? I know a lot of our viewers have heard about gonorrhea. So could you help us? When we say gonorrhea, what is it about? So
gonorrhea is also a sexually transmitted infection, which is caused by a particular type of bacteria called Neisseria gonorrhea.
Okay.
Yes. So this organism gets into contact or gets into the human body through sexual intercourse.
Okay.
And gonorrhea can affect both males and females equally.
Okay.
So when someone has that infection and then engages in sexual intercourse with with his or her partner, whether male or female, is capable of transmitting that bacteria to that person through sexual intercourse.
Okay.
Also, pregnant women can also get sexually transmitted infection, can also be infected with gonorrhea, and they can carry that organism throughout the pregnancy. Okay. So that they can transmit the bacteria to the newborn during childbirth through the birth canal. So as the newborn transits or goes through the birth canal during delivery, because the organisms are in the birth canal, the newborn gets into contact with them and then also gets infected. And that usually affects the eye of the newborn, so they may come with eye discharge. Okay.
Yes. So in the babies, do we also term it as gonorrhea, or it has another name?
Yeah, so that is also gonorrhea infection, but because it affects the eye, it's conjunctivitis, or medically we term it as ophthalmia neonatorum. So
ophthalmia neonatorum.
Yes.
Wow, I got it right.
Yeah, that's a mouthful of
word.
The neonatorum means so a neonate, okay, and then the ophthalmia, disease condition affecting the eye. So it's transmitted through sexual activity. Then also it can also be transmitted during delivery to the newborn as well.
Okay.
Yes.
So this newborn having this eye infection caused by gonorrhea, could someone say that if this child grows, can he transmit this organism to another person through sex? Is that possible?
No, so commonly for a newborn, it affects the eye. And once it's treated well, they may not develop any complication of the eye. and they can be cured. Okay.
Okay.
If it's not treated properly, they may develop several complications of the eye. So when you look at the superficial part of the eye, the surface of the eye.
That's what I see when I look at
yes.
you. Okay.
That is the part that usually gets infected. Right. And if it's not treated, it can lead to scarring. Okay. So the superficial part of the eye is transparent. So when it's scarred, it becomes opaque. So then the newborn loses his or her sight. And that cannot be transmitted sexually. Okay. From when the newborn grows, no.
Okay. Okay.
But when an adult has the infection, that adult can transmit it to his or her partner through sexual intercourse. Yes.
Okay. So, Doc, you mentioned that it can be spread through sexual intercourse and also through the birth canal. Is there also a possibility that if someone has gonorrhea and you get in contact with maybe any of his or her body fluids, like blood or saliva or urine or anything, is there a possibility that you could also get gonorrhea?
So it's not commonly transmitted through those body fluids.
Okay.
It's mainly through sexual intercourse. Fluids. Yes. So some people may fear that, oh, if someone has gonorrhea and I sit by the person and I come into contact with the person's sweat, I'm going to get gonorrhea. That's not how it's transmitted. Okay. Gonorrhea is mainly a sexually transmitted infection and also transmission through the birth canal. So, yes.
Okay. All right. All right, Doc. We will move on to between males and females. In which people is it more common, or is the rate the same when it comes to the gender?
So basically, it's common in both males and females. Okay. But the differences may be in the rate of transmission. Okay. So there's been several studies. Some talk about 20 to 80% transmission from a male, about 80% transmission from a male to a female. So if the male is infected, then the male comes into contact with a female partner who is not infected, the transmission is quite high from the male to the female. And then other studies also talk about when you have an infected female partner, the transmission is from that to the male is between 20 to 50%. But whichever way, once someone has gonorrhea and you have intercourse with a person, you still have a high chance of getting the disease. Yeah. So it's common in both male and female. It's not really selective that it's a female disease or a male disease. It's common in both. But the transmission rate may differ. Okay. But disease transmission also depends on the host factors. Okay. So how you are resistant to a particular disease. So for instance, someone may a healthy person may have sexual intercourse with an infected person, and the person's immune system may be strong that it may overcome it. Okay. So it's also based on individual differences, but then it's not gender selective. Okay. Anyone at all can contract gonorrhea. Okay. Yes.
And doctor, you realize that there are people that engage in the non-natural way of sexual intercourse. We have some people doing oral sex, other people do anal sex and other forms of sexual stuff. With gonorrhea, does it only come about when there's the natural way of having sexual intercourse, or if you engage in other things and your partner has it, it can be transmitted?
That's a very important question. So it's transmitted through other unnatural means of sexual intercourse, unnatural sexual activities. And with that, even the transmission is quite high.
Wow.
Yes. So it can. So those who engage in anal sex, oral sex, can also get what we call anal gonorrhea.
Okay.
Yes. Oral or pharyngeal. So pharynx is the throat. So those who engage in oral sex may get gonorrhea of the throat. So they may have sore throat.
Wow.
Which can be very difficult to treat because the doctor may think that, oh, this is a normal
upper respiratory tract
infection. Yes.
Okay.
Until you have a high index of suspicion, or the person discloses his or her sexual activity to you before you may be able to think that, oh, this could be pharyngeal gonorrhea, and then you treat the person. Yeah. So other unnatural sexual activities can also lead to gonorrhea. Through the anus, the oral, yes, as well. So it's not only penile and vaginal
sex.
Yes. And let me also chip this in that we are talking about adults, but if you have a child who, so that there have been some children that we diagnose gonorrhea, if you have a child that exhibits the symptoms, and if it's proven through diagnostic test, that child is most likely suffering from having been abused sexually.
Oh, okay.
Yes. So children can acquire through sexual abuse, defilement, and other.
Okay.
Yes.
All right. All right. I think I've learned a lot today, and I know you've also learned a lot. But we'll go for a short commercial break. When we come back, we continue with our discussions. Please don't go away. Hello, welcome back from the break. If you just joined in, you've not missed much. You can send in your questions via our WhatsApp line on 0559 680066. I repeat, 0559 680066. You can also send in your questions via our social media handles, both Facebook and Instagram, on Hope TV GH, Hope TV GH, all in lower cases. My name is Bibi, and this is Healthy Living on Hope TV. So, Doc, from where we left off, I would want to know, what are some of the symptoms? What can you see in your body? And then you know that I'm suffering from gonorrhea. So,
both males and females may not have any symptoms at all.
Okay.
When you have gonorrhea. So you can have someone who engages in sexual intercourse with a partner who has gonorrhea and gets infected. And the person will be walking around normally with no symptoms at all, no pain anywhere, nothing at all. And that person still has the gonorrhea. And that can also, the organism can be causing complications. Even without the symptoms. So commonly, both males and females may not have any symptoms at all. That is termed asymptomatic. Yes. But commonly, you exhibit symptoms. So when you take a female, so the female genital tract is different from that of the male.
Sure.
Yes. The female genital tract doesn't communicate with the urinary system. So when you have an infection, gonorrhea infection, commonly the infection affects the vagina,
Okay.
the urethra, and it affects other reproductive organs. So
Right.
you can have infection of the cervix, which is the opening into the womb.
Okay.
And then the womb itself and the inner lining of the womb called the endometrium.
Okay.
And then the tubes. So when a female ovulates, the ovum or the egg is captured by the tubes, the fallopian tubes.
Okay.
Infection can trickle into the fallopian tubes as well. And because the tubes communicate with the female reproductive organs, the fallopian tube opens into the pelvic cavity.
Okay.
Okay. So the infection can also trickle into the pelvic cavity and cause infection there, and then ascend into the abdomen as well.
Okay.
So the symptoms will follow through the way the infection spreads. So a female can come in with burning sensation or pain during urination. Okay. Oftentimes too, they may have discharge from the vagina, which can be whitish or yellowish or even greenish. Yeah. And they may also have lower abdominal pain, so pain in the lower abdomen.
Okay.
And sometimes that pain can be chronic. So you can have someone come in and always complaining of pain in the lower abdomen. You may do several investigations, or you may be treating the person for other things, but it can be gonorrhea infection. So they can come in with chronic pelvic pain as well. Yes. And then when the infection goes into the womb as well, and infect the inner lining of the womb,
right.
They can come in with bleeding. Okay, so a woman will come and tell you, oh, I had my menses the 1st of November, but comes in on the 15th of November, bleeding again. Okay, and then when the menses is up, the person bleeds again and tells you that I have some discharge, which is yellowish to greenish, tinge and all that, and that can be the symptom of gonorrhea as well. Yeah.
Okay.
And so when the infection also spread into the lower abdomen, as I said initially, it leads to a condition called or the pelvic region, it leads to a condition called pelvic inflammatory disease, PID.
Okay.
And that can make a woman who is infected quite sick. So they come in with severe lower abdominal pain, with fever, shivering, and even vomiting.
Wow.
And then offensive vaginal discharge, which can be yellowish or greenish. And that could be the signs of pelvic inflammatory disease. And that can lead to several complications and even death. If not managed urgently. Because the infection can now go into your bloodstream and then spread to other organs. Yes. So that is with females.
Yes.
So when you take a male, so there is some communication between the male genital tract and the urinary system.
Yes.
So the urethra, that is the canal or the passageway through the male's penis.
Okay.
Okay. So it communicates with the male genital tract.
Okay.
Through several tubes. And then there is a connection with the testicles. So when a male ejaculates, the sperms go through those tubes and then go through the urethra. The same way when urine is produced, urine goes through several tubes and then finally gets through the urethra. So that's a common passageway between the reproductive system and the urinary tract in the male. So when a male gets gonorrhea through sex, the infection can affect the urethra and then the reproductive organs, those tubes, the epididymis, Those are some of the tubes that semen or sperms go through during ejaculation. And then the infection can also spread to the testicles. So a male may present with burning sensation or pain during urination.
Okay.
Yes. And then urethral discharge. So a typical male may complain to you that, oh, when I'm there, I see some fluid coming from my penis, which is whitish or yellowish or greenish. And I have some burning sensation in my urethra. Yes. They may also have pains in the scrotum as well, and lower abdominal pain. Okay. Yes. So typically that's how it presents in, but we talked about other unnatural means of sexual activity. Yes. So anyone who engages in anal sex and gets anal gonorrhea may have anal pain, which can be quite excruciating, very painful, and also may have bleeding from the anus as well, and anal discharge could be yellowish or greenish discharge from the anus. They may also have anal ulcers from the sexual activity and also from the infection itself. Right. Yes. Yeah. And then when you take oral, people who engages in oral sex, they may have a sore throat. Okay. Which can be there for quite a long time. Yeah. Yes. So those are the common ways that it presents. Okay. That's gonorrhea presents in both males and females. So if it's a baby who gets it through the genital tract, we talked about the eye infection. Yes. So discharge from the eye, which is usually yellowish. And this usually occurs roughly within 5 days after birth. Okay. Yes. Okay. Right. So, Doc, gonorrhea, I have symptoms. Well, if I come to the hospital, how will it be diagnosed? Because I know a lot of people have it, but they are shy because they think they'll go through some serious test, so they keep it to themselves. How is it diagnosed? Yeah, so when one presents to us, they may present with several complaints. Okay. They may come to you complaining of lower abdominal pain, pain on urination, or discharge from the urethra, the penis, or discharge from the vagina. Okay. Yes. So when they present to us, we take a detailed history. We go into the symptoms, ask them several questions, and then examine them as well. But then we diagnose them laboratory-wise as well. So we take samples. So commonly they may come with discharge. So we send them to the lab and we take a swab of the discharge, and we can examine this discharge under the microscope. Okay. Yes. And there are newer techniques that are quite modern that we use in also diagnosing it when we take those discharge. But also urine. When we get a urine sample from someone with infected person. An infected person, we can also do several labs on it to be able to identify the gonorrhea organism in it. Okay. Yes. Okay. And so when they come, we as physicians, we use our skills and other diagnostic techniques to arrive at a diagnosis. And most people, when they come, already they are quite suspicious that, especially once they are sexually active and they've engaged in a high-risk sexual activity, and when they come in with those symptoms, they may even volunteer and tell you that, oh, I think I have gonorrhea, or I think I have a sexually transmitted infection. Okay, because I engage in an unprotected sexual intercourse, and after some time I notice this discharge from my penis or from my vagina, so I think I have an STI. Some people may volunteer, but when they come, we do well to diagnose them as well.
Okay.
Yeah.
Right. Doc, let me take you back a little. When we were discussing about the symptoms, you mentioned that there are some people that could stay without symptoms, but they would still be infected. How long can someone stay with gonorrhea and not experience any symptoms at all?
Yes, so we talked about people being asymptomatic, that is, they don't show any symptoms, but they have the gonorrhea infection.
Right.
I mean, it can be there like forever, for a very long time.
Okay, like years?
Yes,
wow.
years.
Okay.
Without showing, and that's why it's quite dangerous, because then you see someone without the symptom, and then you engage in sexual activity with a person, and you can contract the infection.
So, sorry to cut you. So, if you stay without symptoms, it's still possible that if you engage in sexual activity, you can infect someone.
Yes. So the transmissibility or ability to transmit it is not dependent on the symptoms. That this person has discharge or has pain, so that person will easily transmit it. No. Once you have the infection, you are capable, even if you don't show any symptom, you are capable of transmitting it to a healthy individual through sexual activity. Yes. So that's why it's important that we educate people about this, and then so that they will be mindful of their sexual activity.
Okay. Right. All right. I know you are learning a lot, and the discussion is becoming very interesting and educative as well. But we need to go for a short break, and then we continue afterwards. Please don't go away. Hello, and welcome back from the break. I know you are having a very good time and you are getting more information about our topic for discussion today, which is gonorrhea. My name is Bibi, and this is Healthy Living on Hope TV. Remember that you can send in your questions via our social media platforms, via Facebook and Instagram on Hope TV GH, Hope TV GH, all in lower cases. You can also send your questions through our WhatsApp platforms on 0559 680066. I take it again, 0559 680066. Doctor, we have some questions from our viewers, so I'll take it one after the other. The first is, the person says he's not had sex before, he's 16 years, but he's experiencing some symptoms that looks like what we are discussing about gonorrhea. How does he report it? Is there a way he can be helped?
So, symptoms of diseases mimic each other. So, diseases present with common symptoms. Okay, so someone may have, let's say, malaria, but may have other symptoms that look like typhoid. So the best thing is for her to present at the hospital, so that we examine her thoroughly and know actually what is wrong with her, because the symptoms she may be experiencing whilst listening to this program may think that is gonorrhea, but may not be gonorrhea, but maybe something else like urinary tract infections, which is quite common in females. Yes. So my advice to our viewer is that she should report to the nearest health facility, so that the physician will examine her and then do the relevant diagnostic investigation, so that they will know the exact cause of her symptoms. Yes.
Okay, right. I move to the next question. The person says, can STI result in Staphylococcus. I don't know what that means, but I'm sure being a doctor, you understand that. He says, please, can STI result in Staphylococcus?
Well, Staphylococcus is another bacteria. So essentially, the answer is no.
No.
Sexually transmitted infection resulting in Staphylococcus infection is no.
Okay.
So I don't get the full import of the question very well.
Okay.
But what I get is the viewer wanted to know whether sexually transmitted infection will lead to another infection like Staphylococcus, which Staphylococcus usually affects the skin.
Okay.
Okay, yes. It can affect other organs and cause severe illnesses, but commonly it's not transmitted sexually.
Okay.
Yes. So it's a staphylococcal infection, which is a bacteria, is not sexually transmitted. And a sexually transmitted infection will not lead to that infection. Yeah, so it's no.
It's no.
Yes.
All right. All right. So we quickly move to treatment.
Okay.
What are some of the treatment? If someone reports or someone experiences these symptoms and diagnosis is confirmed that is gonorrhea, what can the person do?
So the treatment is done in the hospital. Okay. So when one has symptoms, the person needs to report. And reporting early is very important.
Okay.
Because then we be able to treat you early without complications. So when you come and we've assessed you and done all the relevant investigations and concluded that you have gonorrhea, we commonly treat with antibiotics.
Okay.
So these are drugs that have been developed to kill microorganisms or germs.
Okay.
So when we take samples, like your urine or a discharge coming from your penis or vagina and take it to the lab, when we identify the gonorrhea organism, we also do what we call sensitivity test to determine which antibiotic can fight your gonorrhea very well. Okay.
Okay.
We have several antibiotics that we use, or conventional antibiotics that we use in treating gonorrhea. Okay. But we also do the sensitivity test to know which antibiotic or drug can kill the organisms, because sometimes some of these organisms develop into several strains and they are resistant to the common antibiotics that we use in treating it.
Okay.
So when we do these tests, it helps us and guide us to know which. So for instance, commonly a drug like ceftriaxone and azithromycin is used in the treatment. I'm not telling my viewers that when you think you have gonorrhea, you should go and take these drugs. It can only be prescribed by a physician.
A physician, okay.
So these are some of the common drugs that we use. But then we do these tests to know that whether the organisms can be sensitive, can be killed by these,
a particular medicine.
These drugs.
Okay.
If the organism is resistant, then we choose the drug that can kill the gonorrhea infection.
Okay.
Yes.
Oh.
So after treatment of the infected person, it is imperative that we also treat the partner.
Right. Right.
Because if you treat the infected person who has presented to you in your consulting room and you leave the person to go, the person may come back.
Go back and reinfect
himself. Because if the partner, the person may go back to the partner and then get a reinfection and come back to you again.
Yeah.
Okay. Or may, so we advise them, we counsel them to bring their partners so that they are also tested and treated as well. One thing that we need to note is that when you contract a sexually transmitted infection, you stand a high risk of getting other sexually transmitted infection.
Okay.
So in our management, we also do tests for other sexually transmitted infections. So someone comes in and I think the person has gonorrhea. I will order for other tests, like testing for syphilis, HIV, hepatitis B and C.
Okay.
Because the infection with gonorrhea also increases your chances of getting those infections.
Okay.
If that person is carrying it.
Okay. All right.
We may not get time to explain all the mechanisms. So we do all the tests for all those infections as well. And if they are present, or the person has that infection as well, then we manage them as well.
As well.
Yes.
Right. I'll read some of the questions I have. The viewer, this is Amos from Techiman. He wants to ask Doctor, can herbal medicine cure gonorrhea? He wants to know if herbal medicine can cure gonorrhea.
Well, some herbalists and homeopathists claim they can cure gonorrhea with their medicine.
Okay.
That is not my area anyway. So I can comment much about it, but most of the people we see at the consulting room, before they even come to us, might have used some of those things, and commonly they are not effective.
Okay.
Okay. Commonly they are not effective.
Yeah.
So because like I explained, you need to do sensitivity testing to know which antibiotic or drug can kill these organisms.
Yeah.
And they may not go through all those protocols, okay, to be able to know the exact drug that can kill the organism. So in case you are dealing with a very resistant, hardcore organism, you will find you have difficulties. Okay. So for me, I will advise anyone that if you are having any symptoms, please report to the hospital so that you get a comprehensive care.
Okay, right. I have another question from a brother called Dan. He wants to know, can pregnant women treat gonorrhea? Because I know pregnant women, mostly they don't take some medications. So if a pregnant woman gets gonorrhea, can it be treated? Yes,
so a pregnant woman who has symptoms or who is screened for gonorrhea, if we confirm that that pregnant woman has gonorrhea, we treat it. And there are drugs that are recommended in pregnancy that is used in treating gonorrhea. Because if it's left untreated, it can lead to several complications, which I'm sure we'll talk about those complications. So that's true. A pregnant woman can be treated for gonorrhea.
Okay.
Yes.
Okay. We have another question from Alexander. He says he's been experiencing some whitish fluids from his penis, but never experienced any pain during urination. But anytime he visits the washroom, he sees the whitish fluid, and also he has waist pains. So he wants to know, is it gonorrhea?
So I can't conclusively say that, this discharge is the discharge of gonorrhea. When you have the infection, you may not exhibit all the symptoms and the signs. It could be other sexually transmitted infection or something else. So this person needs to report it so that we do several investigations. So the discharge that is coming out can be swabbed and taken to the lab and examined for gonorrhea or other sexually transmitted infections.
Tests. All right. So, doctor, we quickly move to complications. I think we've spoken at length about gonorrhea. If you don't treat it well, or if you leave it untreated, what are some of the complications?
So, when you take a female, gonorrhea can cause very serious complications in the female reproductive tracts. We talked about PID, pelvic inflammatory disease, being caused by gonorrhea. Also, gonorrhea can lead to infertility. So the organism can cause scarring of the fallopian tubes. So the fallopian tubes, the tubes that are attached to the womb. And so it sort of captures the egg or the ovum when a woman ovulates. If a woman gets gonorrhea and is untreated, it can lead to scarring of the fallopian tube. So it can narrow the lumen, the canal, the inside of the fallopian tube, or occlude it completely. So if it, for instance, if it narrows it, okay, and the woman ovulates, okay, the sperm can go through the narrowed portion, okay, and then fuse with the egg. Right. But then when fusion occurs and the pregnancy starts growing, it will not be able to go through the narrowed portion. So the pregnancy will get stuck in the fallopian tube and keeps growing and growing, and it can rupture, and that's what we call ectopic pregnancy. Okay. So gonorrhea can lead to ectopic pregnancies, which can be fatal. Yeah. It's life-threatening. Also, when the lumen or the canal of the fallopian tube is completely occluded, then sperm cannot even penetrate the fallopian tube to fuse with the egg, and that can cause infertility. Yes. Also, I mentioned long-standing pelvic pain. Yeah. That is one complication that can result from gonorrhea. So a woman can have severe pain in the pelvis for a very long time, and that can be quite distressing. Another complication is that it can disseminate or spread through, move from its localized site, that's the reproductive organ, and then spread to other organs. So it can spread to the joints. So you start having wrist pain, joint pains. Wow. Yes. It can also spread to the liver. We call it causes inflammation of the liver. There's a medical term for it. Quite a mouthful. I wouldn't want to mention that. Yes. So those are some of the complications. It can, in very severe cases, it can even spread to the meninges, the membrane surrounding our brain and spinal cord, and cause meningitis. Yes. So those are some of the complications. For a male, it can also cause infertility through scarring of the tubes through which the semen or the sperm go through, the epididymis and the vas deferens. Yes. So those are some of the common complications of gonorrhea. So if you have a newborn who gets gonococcal eye infection, and if it's not treated, it can also lead to scarring of the eye, and then lead to long-term blindness. Yes. So those are some of the common complications.
So doctor, quickly, I think our time is almost up. We have a few more questions. We've touched on this already, but I believe the person just joined in. The person wants to know, is there a difference between gonorrhea and urinary tract infections?
Yes, so gonorrhea is basically sexually transmitted. And urinary tract infections affect the urinary tract. So your urethra, the bladder. The bladder is what stores the urine. And then your ureters. Your ureters connect the bladder to the kidneys. And then so the infection can affect your urethra, your bladder, your ureters, and the kidneys. So infection in the urinary tract is what is urinary tract infection, and that is not sexually transmitted. That is transmitted through other means. But gonorrhea is sexually transmitted, so through sexual intercourse. Yes.
Right. And then quickly, the last question. The person says he's not experiencing any symptoms, but if he goes to the hospital, can he still be diagnosed?
Yes.
Is there a way, or someone needs to show the symptoms before he can be diagnosed?
Yes. That's a very important question. We talked about people not being symptomatic, not showing any signs, but then they may have gonorrhea. So you can actually go to the hospital and be screened for it. So we can take your urine, and then do several tests on it and then be able to identify whether you have gonorrhea or not.
Okay.
Yeah, so you can be screened. Actually, in the advanced countries, it's not done commonly here, but in the advanced countries, most of the young people in the reproductive age group usually goes to their clinics, and their GPs may screen them for sexually transmitted infections.
Yeah. Okay.
Prevention.
So, doctor, finally, how can we prevent gonorrhea?
So, I think the prevention is basically not having sex.
Okay.
Okay. Yes. So, abstinence is very important in the prevention of gonorrhea. Okay. Especially in unmarried youths. Yes,
yeah.
unmarried people. Yeah. Otherwise, maintaining a monogamous relationship is also a way of reducing the risk of developing gonorrhea. Okay. Also, barrier methods in through sexual activities, barrier methods like the use of condom.
Okay.
Has been is helpful in the prevention of these sexually transmitted infections, especially gonorrhea.
Okay.
But in an unmarried youth, abstinence is the best. Yes.
Okay. All right, doctor. Thank you so much for helping us understand this topic.
You're welcome.
And to our viewers, thank you for making time to watch Healthy Living on Hope TV. I believe you've learned a lot on today's show, and you don't want to miss the next episode that will be aired same time next week on Hope TV from 8 p.m. to 9 p.m. I've been your host, BB, and join me same time next week on Hope TV on Healthy Living, and take care of yourself. Bye-bye.